The synopsis, which will be discussed by Galia.
Patient under the name Jess, a 47-year-old female, was observed complaining of polydipsia and polyuria. She also endorsed being weak and feeling dizzy most of the time. Based on the symptoms she has experienced, such as excessive urination at nights, excessive thirst, feeling weak, and dizziness, the group has assumed that she has developed neurogenic diabetes insipidus.
So for the introduction of our study, what is neurogenic diabetes insipidus? So neurogenic diabetes insipidus is a rare endocrine disorder where damage to the hypothalamus or pituitary gland results from a deficiency of arginine vasopressin secretion, also called the antidiuretic hormone. So this antidiuretic hormone not only affects children but also men and women at any age. And the common cause of central diabetes insipidus is a head injury, specifically damage to the part of the brain that provides vasopressin or to the nearby pituitary gland. This happens mostly when a surgery is performed to the brain or when accidents or fatal injuries to the hypothalamus part or the pituitary gland. Vasopressin antidiuretic hormone has the primary function to regulate the fluid balance inside the body and the proper flow of urine inside the kidney, according to Johnson & John's 2020. Any damage caused to the part of the brain would result in a deficiency of antidiuretic hormone. And this can occur as a result of an infection, surgery, tumor, or other causes like inherited genetic disease. Thus, the patient in this case study shows symptoms like polyuria, or what we call the excessive urine output, and polydipsia.
in the posterior pituitary. The secreted hormones, which is the ADH, then enters to the blood vessels to deliver in the different sections inside our body, like the kidney. Once the ADH are inside the kidney, they bind with the V2 receptors on the renal collecting duct. And when signals are received to the activation of GS adenylyl cyclase system, phosphorylation of water channel will happen, and this allows water to flow through what we call osmosis. The last one is that the patient feels dizzy and weak. The reason behind the dizziness and weakness to someone who has central diabetes insipidus is the body will experience difficulties retaining sufficient water, even though if you drink enough fluids. And if the body loses too much water, the amount of these electrolytes may increase simply because the amount of water in which they are contained has decreased. This can result in dehydration, which is a severe lack of water in the body that will lead to dizziness and weakness. Now, let's take a look at the conclusion, which will be discussed by Galia and Dako.
So for the conclusion,